Welcome to the Learning Center, a place where nurses can learn and discuss the newest and best practices to triage their patients. I am Marcy Line, the TriageLogic Nurse Educator. In this video, we will go over the final 3 steps that are critical in the triage call process. These steps are giving relevant care advice, making sure your patient knows callback symptoms, and offering reassurance to your patient. Let's start by briefly reviewing steps 1 through 7. You can also watch our past video courses located on the Learning Center to get more information on each step in the triage call process. Step 1. Introduce yourself, including your title and the practice you're representing. Step 2. Collect or verify demographic information. Step 3. Collect a brief past medical history. Step 4. Let your patient talk. Step 5. Document a brief yet complete assessment. Step 6. Choose the right protocol. And Step 7. Get your patient to the right level of care. Care advice should be specific and targeted to each individual patient and their current symptoms. Giving the patient care advice they do not need is time-consuming and may be confusing to the patient. Before giving any care advice, the nurse should take into account all the previous steps she has done in her call so far and further scale her care advice. Here are a few examples of how past medical history or current health conditions will influence care advice. Your first call of the day is a 21-year-old college student who is studying for her final exams. She's been up late at night reading and probably not eating or drinking well. She has no health conditions, is not pregnant, has no allergies, and is not taking any medication, either prescription or over-the-counter. She is calling you because she has a mild headache and doesn't know what to take for it. You complete your triage and determine her symptoms are probably safe for home care advice, so you recommend the appropriate dose of Motrin, resting in a dark, quiet place, perhaps using a cool compress over her forehead, and practicing some simple stretching and massage techniques. Your second call of the day is very similar, except this time your patient is 25 weeks pregnant with her first child. She too is 21 years old, healthy with no known drug allergies, and is not taking any medication other than a prenatal vitamin. Your second caller's care advice is going to differ slightly because of her pregnancy. While resting, cool compresses, stretching, and massage would be appropriate care advice, the Motrin would not. While giving care advice to your patient, the information should be presented in an organized way. Each piece of information or advice should be preceded by the nurse introducing the topic. For instance, if you are going to explain what to do for a fever, you should start by saying, I am going to give you some information about fevers. This way the patient knows what to expect and is ready to process information on how to treat a fever. The nurse should remember, this is not a race to see how fast she can go through the care advice. The patient needs to be able to process the information and understand each part before moving on. Speak slowly and pause between topics. This gives the patient time to process the information they received and ask questions before moving on to the next piece of advice. If the caller has already tried appropriate care before calling you, this step is also a nice time to reassure them that they are doing a great job. The most important thing to remember about giving care advice is to not delay care. If the disposition was go to ED now, the patient only needs to know limited information, such as do not eat or drink, or have someone drive you now. The rest of the care advice will be given in the emergency room. The next to last step after giving the care advice is to give the patient callback instructions. While it is impossible to go over every worst-case scenario with the patient, the nurse should give the caller basic symptoms to watch for that would indicate a callback to nurse triage is warranted. Along with what symptoms to watch out for, the patient should also be given a time frame, such as, if your fever does not resolve within 3 days, you will need to follow up with your physician. Or, if your cough does not improve in 1 week, please see a doctor. Just as with care advice, the callback instructions should be reviewed slowly, and the nurse should take pauses between topics to allow the patient to write down these signs, symptoms, and to ask questions. Finally, the last step of the 10 critical steps to a triage call is perhaps the most important step in the entire process. It is making sure your patient understands the care advice, callback symptoms, and is willing and able to follow the plan of care that you went over with him. Steps 1 through 9 will not mean much if your patient doesn't understand what was told to him. Your ending statement needs to be direct and simple, such as, "Do you understand the care advice and callback symptoms we reviewed?" And, "Are you willing and able to follow this plan?" Keep in mind, patient safety and well-being should always be your top concern. Please visit our Learning Center for more articles and videos. Feel free to leave comments and share this video with your colleagues.